So, folks, welcome back to the Dental Implant Podcast. And some of you may be thinking, Pab, what's going on? Because you always promise us regular episodes, and then I go quiet for a long period. And now you're getting regular episodes. So I am trying. I am trying, folks. I'm very excited today to have Dr. Elitsa Vaneva join me. Please forgive me if I've mispronounced that.
You can it's perfect.
Correct me if you need to. And the reason why I asked Dr. Elitsa to join me is I was at a conference with some of my mentors and people that I look up to, and they were mentioning something very specific about a particular product, which it solves a very important problem. And this is why I reached out, because I wanted to know more. And this is why we're on the podcast today. So, Dr. Elitsa, if you wouldn't mind just telling everybody a little bit about your background. And I think the best place to start with this would be, what's the problem that you're solving? So once you've explained what you identified as the problem, then we can move into more about what you've been doing and more about the product as well. So please, in your own words.
Yeah. Thank you, Dr. Pap, for the invitation to be here together with you in your podcast. I'm really honored to be here. And to get straight to the topic, I saw that we solve a particular problem in implantology, and that was the fact that people were putting so much effort into clinical excellence, what they do with implantology, how they perform their protocols, and above their protocols, how they plan the whole procedure from end to finish. But they don't get the most out of their healing phase in what regards to osseointegration. And they leave a small percentage, but a very, very, let's say, significant one, even though small, to a variable that they are not taking into account. And this is the biofilm, and that's not plaque. Biofilm precedes plaque. It is what, when we say bad oral hygiene, it's not only about bad oral hygiene in patients, and also the microbiome in regards to the biofilm. So implantologists were having exquisite protocols, and they were trying to control every variable on the road, but they were missing something that determines the results, because in 98%, everything is great with implants, but those 2%, in 60% of the cases, they are lost. This implant failure is because not anything else but biofilm. And our invention in biofilm control turned out to be so relevant that since our launch last year, world famous and renowned experts in the field of implantology have taken interest, have started working with it, have seen how much time and expenses it saves them and their clinics, that we have gained world recognition and now are present in whole Europe, UK, and hopefully very soon overseas.
Amazing. So a couple of things. Could you give everybody your background? I know you mentioned some world-renowned surgeons. You can name them. It's fine. It's not a problem. Okay, so I'm sure they won't mind either. But could you give us a little bit about your background, like so that we understand a little bit more about you?
Okay. So I'm a practicing dentist now 13 years. I started my academic career 3 years after I graduated. I hold a PhD. And I'm a Master of Science in not implantology, but pediatric dentistry and prevention, which is a surprise to many people, and hence my very deep and comprehensive knowledge in the biofilm and in prevention. And in 2016, when I was already practicing 3 years, I encountered this problem, the fact that we had a clinical gap between what we do in the dental office and how people maintain it. And it was also a matter of tools, what they had available. And also it was a matter of protocol, because whenever we recommend something to them, in only 10% of the cases, they go and get it. They usually say, yes, I'm going to get it, and then they forget. So I had a problem with that, and then I focused on biofilm and created something that we have international patent application on. And this is a really, I think, world-shattering invention when it comes to the way oral cavity and whatever we place as materials in it is, let's say, managed. Because for now, what did we have? We had antibacterials that just kill superficial bacteria, but we shouldn't care so much about the bacteria. We should care about how they express their pathogenic, let's say, activity. And that's only in biofilm. If you don't have it, you will not fear bacteria anymore, and it will just be a microbiome. So, because, we have it in our whole body. And I have also, I own a dental clinic. We, besides me, we are a team of 4 more dentists. We are focused not only on pediatric dentistry, but also on comprehensive approaches to treatment. And I just love dentistry and our field and our industry. And my need when I discovered this substance was to take it as fast as possible to as many practitioners as possible and change our life and the way we practice. So that's why I built a startup company, and we fundraised, we went on market, and I think that's enough of a background, maybe.
Yeah. So what you're saying to me is you're an expert in business as well. So that's very impressive. That's very impressive. So I just want to clarify that. Yes, you're absolutely right. For me as a dentist, particularly somebody who places implants, when I'm doing these big complex cases, I can plan them to as high standards as what I possibly can, and I execute it. And then afterwards, my perception up until now has been the patients just need to keep it clean. And because of your PhD and your expertise, you're like, hang on, there's this biofilm aspect that you guys aren't controlling, which actually we can control. Is that correct? Is that kind of like where this thought process comes in? So please tell us a little bit more about how we can, I don't want to say disrupt or manage the biofilm, but just tell us more about the process and the scientific evidence that you have. Because I know you've sent me over some papers, which is very kind of you. But for those listening, let's start to give them a little bit more information. So we know what the problem was. What are the outcomes of that problem, and then how are you managing to solve these issues?
Okay, so. Thank you for the question, and let's start with the fact that what was the problem before? We identified the general problem, but we were using the antiseptics, which I totally agree that they are valuable. We are not saying to dentists, okay, now you have to forget the antiseptics because they have their clinical value. But the problem with them is first, they're just superficial action because it's usually a rinse and it just rinses over. And doesn't disrupt the biofilm in its inside, let's say, and doesn't also help much with reattachment, because after we stop this, because implant healing takes more than a week or 2, or usually the antiseptic phase, when we stop it, in a couple of days, the biofilm starts reorganizing. And then it becomes populated with species, and then the species change from with their pathogenic activity, they become more periodontally pathogenic. The Porphyromonas gingivalis comes along, and we know that it is crucial in implantology. And that happens in the months that the patient is out of office. And usually it happens also without much visible plaque, because usually in this period, patients, they use PMMA. PMMA, if you magnify it, even though it's well polished, you will see that there are micropores in it, and biofilm builds up. And you can have inflamed gums and, just seemingly discolored PMMA. So what our technology does, it had to clean with it. So we put our invention in the form of a toothpaste just so that patients use it easily and they can at the same time brush with it. So it's like a surface conditioning toothpaste. Imagine it like that. And this free fatty acid complex, together with the other ingredients, they cover the surface, and that's really valuable because fluoride only remineralizes natural tissues. When you have, like an artificial material, you cannot do much with fluoride. Mm-hmm. And our surface conditioning agents, they cover the surface and make it less favorable for bacteria to attach. So we have investigated it in even one of the most advanced bioreactors in the world, which is very interesting. It's an artificial mouth model study that you recreate the mouth environment. You feed it with the microbiome of many patients. The artificial mouth feeds, you brush the samples inside. So what we saw that, and that's a proven effect also not by us, but previously in science, that bacteria don't attach to the surface. They stop creating the matrix. This is their glue. Their extracellular polysaccharide, that's some tough words, complex, and they just don't attach to it. And this doesn't go only for biofilm-forming bacteria like Streptococcus mutans family, but also to Porphyromonas gingivalis that has also been proven independently from us scientifically that free fatty acid, specifically oleic acid, that is in the largest amount in our product, that it can do it. So when you stop the initiation, you clean with it. Of course, you brush with it. Okay, you have a clean surface. But before now, any other product just didn't stop the reattaching and the renewal of this biofilm building process. And when you cover it with our product, then the patient's teeth for 12 hours, because we have tested everything that we did only on 2 times use per day. So we can safely say that it gives you 12 hours. And it just stays clean. This is what we do. It's a surface effect. It stays clean, but also free fatty acids have been found beneficial also independently for gum barrier support, because oleic acid also has antioxidant action. It also helps the gums. And in combination with some other ingredients put in the product that deflame tissues, we have a full effect, clean surfaces and calmer gums that will get us more predictably to the final scan. Because probably sometimes the patient is traveling, he comes with the PMA, you have to scan, you have to create the final prosthetics, but if you create it from an inflamed tissue context, then you get not the same profile of prosthetics that you would need.
I mean, that's really, this is fantastic. So effectively what we are saying is, as implant surgeons, particularly with full mouth, is historically we've been like, it looks clean, therefore it's fine, but that's not what is actually going on, because something can look superficially clean, but the biofilm is still actually adhering underneath. And what the product does is it disrupts biofilm on a very, very base level. So is that correct? So
yes.
It's actually preventing the biofilm from
reforming. Yes. And because you cannot really see the biofilm since it's not already plaque.
Yes.
You really don't see your problem when the patient comes. You see only the effect of the problem, the inflamed gums, and you contributed to not enough antiseptics usually. And we can have an easier way to manage it. And that's why we focused on starting preoperatively, because the patient can start pre-extraction, pre-procedure in the preparation phase, because you will have also more predictable post-op healing with it. It starts with pre-prep. You use it throughout the osseointegration phase, and optionally, if the patient likes, they can continue using it after the final prosthetics, but that's up to clinician's decision and their discretion, of course. We are focused where we create the highest value.
So effectively, we are optimizing the oral environment as much as what we possibly can. So to me, it sounds like the best way to use this, particularly if you're saying starting prior to surgery, would be a hygiene appointment for biofilm disruption, and then kind of like start it at that point. So everything is as clean as what possibly can. And we're basically just suppressing biofilm formation.
Yeah.
So, that's quite incredible, really. So tell us a little bit about the studies that you sent over to me. What studies have you done? What have you found? And the other thing that I want to really say thank you for as well is when you say that there's certain things that we can't see, but we just see the effects. Because again, I hear this from a lot of colleagues, and it winds me up when they turn around and say, but it looks fine. It's like, hang on, the body works on a histological level, right? Just because it looks fine doesn't mean it's fine. We need to understand that. They say, well, you can't do this. They say, yeah, but can you see osteoblasts and osteoclasts? Because I can't, but I know that they're involved in the healing process. So we need to be very careful of it looks fine versus what's actually going on. So thank you for saying that. But tell us a little bit more about the studies that you've done so far on this.
So first of all, our research is based on previous research. So it is already, even before us, found and proven that free fatty acids, specifically the free fatty acid that we use, it is efficient in blocking those enzymes, the glucosyltransferase enzymes that microbes use to create this matrix. So let's start from this position that's already proven. The problem was that it was not used because fatty acids are not actually free, and we had to free them. So our greatest impact is finding the clean biotechnology to extract from the oils the fatty acids and use them in a free form. And here we have tested the freed fatty acids from our complex in many ways. The first, we started, of course, with the laboratory. And in the laboratory, we found out that it just suppresses it in the lab, in vitro setting. It suppresses the ability of bacteria to create the biofilm, which is great because we don't strive to kill the bacteria. And that, I think that was my wish when I thought of the idea. I think I really like simple things. I didn't want to kill the bacteria, just solve their problem, their pathogenic activity. So I think there we proved the fact that previous research suggested that they suppress it. And then we have tested it on PMMA crowns, we have tested it on teeth, dental surfaces, aligner surfaces. I've tested, of course, patients, their subjective evaluation of the product. And now we have the ability to work with, as you say, world-renowned dentists that present us also cases of their work and see the implementation of this invention in a real, messy environment that the real patients, present, because, laboratory and everything, and also controlled trials, they present a controlled environment. But in reality, it's like a messy kitchen. You have to test it in the messy kitchen with the real practitioners and hear their feedback. And I think the adoption rate and the returning clinics that, implement it in their protocols and start, using it consistently as part of their work, they show us that it works also in the real world of dentistry.
Yeah, I think. Let's name. As I said, we can name these people. I saw it at the conference a few months. I think it was in March, just a few months, and these guys showing their cases without using the product, and you can name it in a second so that everybody's like, what's the product? So we'll name it in a second. But showing the cases where they had the reviews prior and then after starting using these, is just, the prosthetics, they just look clean. It's unbelievable. Even after a few months, they look like they were placed a few hours ago. So it's really incredible. And, some of these guys are dentists that I look up to, that I aspire to be like. We're talking Vinci Stankov, we're talking David Nore, we're talking Stavros Pelekanos, Eric Van Duren, all, that entire group. And these are world class surgeons who are using this. I mean, who else is using it?
Well, this month we shipped also to Florin, so that he can evaluate in his clinic. So we are seeing how the patients will be. So we always like to, respect the dentist, respect the clinician and their approach, because as you also say, that it is not like you have to follow a company manual. Every treatment and every clinician has to gain deep knowledge and understanding of the biology and then apply it to his own hands and desires and goals. So we have also sent to Professor Kelly's clinic also for evaluation. Yeah. I think we are presenting not only an interest but a potential to help clinics manage better their workflows. Because a product can be great, but it can be just a great product. Yes. I think something valuable as a tool is something that you get, you see, and you decide, okay, that works for me. That will change my practice. That will save me money. That will bring me more patients. Because in the end, we run a business, and we run one business that we rely on referrals. And okay, we will save our clinical time by having great biofilm control, but we'll also show unmatched care for our patients, because we are now giving them not only a tool, but we are giving them care, and they are seeing, okay, this dentist is putting the implants and is thinking of me, what I do at home from his clinic, and he's giving me this. He's not sending me anywhere else, because Praeva is not available anywhere else than, to be used in the dental office and given to the patient from them. So I think that's also why famous clinicians are starting to trust our company, because we really focused on the value of the dental clinic itself.
Yes, yeah. I love Florian. He's a critical thinker, and his knowledge is just absolutely incredible. So yeah, this is amazing. So just for those who are listening, I think it's important that I highlight that this is not a sponsored podcast. There's no money exchanging hands. I've asked Dr. Elitsa to come on because I believe in the product and I like it, and I feel that we should be talking about these issues. That this is the reason why. So if anybody's thinking, well, is this a spot? I don't do sponsored podcasts. I don't like doing that. I'll talk about what I believe in, because I think that's the only way that we can do this, really. So what's the product called?
It's called Praeva Perio Implant and Restorative Procare System. And it consists of 200 milliliters of our surface conditioning toothpaste called Equiom Balance. Equiom comes from equilibrium of the microbiome, our goal, and it is sufficient for around 4 to 6 months of post-op care, or if you start pre-op. Again, this period, and this is and it's available only to purchase from dental clinicians from our platform, and this is how we actually get found by people online, and then we are only in the dental clinic. So the clinic, basically not the patient, is the one that purchases this.
Yes. Okay, that makes sense. And I think one of the important things here is, whilst it's an easy product to use, we need to be aware that it sounds like there is a process to actually start using this. Purely from a point of view is, if somebody's oral hygiene is very poor and they just start using it as a toothpaste, the biofilm and the plaque's already established. So it sounds like to me the best way to use this is after a hygiene appointment. Yeah. And 4 to 6 months worth of products, that's pretty good, because sometimes you get mouthwashes, etc., and it's like they're gone in 1 or 2 weeks. So to have something that's 4 to 6 month worth is actually very, very good. Right. So I'm just thinking, have there been any other studies which you've done which have shown the results of what we're getting, or what sort of feedback are you getting from our colleagues who've been using this?
I think I mentioned quite a few studies. Yeah. And the feedback is obviously great. If you are hearing about this from lectures in major international implant events. And by the way, we are a startup company and we don't have the budget to pay these people. So also the people that were speaking and are supporting our products are not getting paid by us as well. And I think that they wouldn't risk their reputation if they weren't happy with what we are doing and how we are doing it.
And I think that's a really important thing to say, because I know these guys, and you know, they think like me, whereas if something's good, they will talk about it, and they were just like, this is what I believe in. This is why, this is how it works for me. So, and as I said, I've seen the results on the conference that we were at a few weeks ago, and it was incredible. It was absolutely incredible. So
yeah, thank you. Thank you. And regarding the way to protocolize it and how to use it, we have also a biofilm control protocol. And what we suggest to dentists on developing their protocol is when the hygienist cleans the patient, not only clean it, but disclose their biofilm and show them what it is. Because most of the time, patients go through life and they never know what biofilm is. And they don't see it. They just think that their teeth are a bit more yellow and they have calculus. So this is, I have yellow teeth and I have calculus. There is nothing in between. So showing and revealing through biofilm mapping is especially important for compliance, because let's face it, our product is not a magic wand. As you correctly said, if the patient doesn't use it, it won't work, of course, because it's not used. And some of these patients, they have lost their teeth because they didn't use any product. Not all of them, of course, but sometimes this is the case. And in order to improve our compliance, it will be great if we do the biofilm mapping, motivate, educate our patients, and tell them exactly why they are getting what they are getting. Just telling that this is professional, and this is professional dental care. It will help them get more safely from A to B, and they have to use it 2 times, 2 minutes, spit and don't rinse, because it has to leave like a barrier. So I think this is one of the other values of our company, that we're just not giving products. We are also helping clinics implement it. We're giving implementation protocols. We're learning materials for the whole staff to learn about it, to learn how to speak about it, so that you gain maximum effect of using it.
So, I mean, purely from a logical point of view, we have a product which genuinely disrupts biofilm. Therefore, it would be great for periodontal patients. Therefore, it would be great if patients are having perioplastic surgery. It would be great for patients who are undergoing orthodontics, whether liner work or fixed. So, whilst this is the Dental Implant Podcast, is the range that you actually have for this is actually quite big. It's quite impressive. And it's nice to hear that it's built on research which is kind of like already been approved. So that's really good. That's really good.
Yeah, we definitely are rooted in science as my scientific expertise. I was also until recently a chief assistant professor at the Medical University of Plovdiv, Bulgaria. And of course, this is not only my invention, it was collaborated. We have used the expertise of biotechnologists, chemists, microbiologists to develop the full formula. And everything that we use, we also care about allergens, the other ingredients that we put inside, and we have made sure, because I'm a clinician in the end, and when I developed this, I wanted to be sure that this is something that I can safely put my reputation behind it when I speak to my patients, and when other dentists speak to their patients, to know that this is something they can safely recommend, prescribe, and use themselves. I think that's it.
Amazing, thank you. So, if people wanted to find out more about this product or purchase it, where's the best place that they can go to? What's the website address, please?
Definitely, our website has dental login that is exclusively from dental clinics, and then they can approach it. They can purchase it. If we're speaking about the different applications. We have the 4 to 6 month package that is 200 milliliters, but we also have one that supports orthodontics, because now today patients are remotely monitored. We don't see them for months in orthodontics. And that's sometimes 6 months, 8 months and more. And it's very suitable for the ortho patients, the 400 milliliter package. So again, it's accessible on the website. And anyone that wants to know more, will be super happy to speak to them, to tell them more, to help them. We have also a clinical appointment booking in our professional login. So if a clinic wants to consult and have a clinic education to their staff, they can contact us. We have teams that support clinic implementation in English, in French, in German, and probably very soon in Romanian.
Amazing. Thank you so much. So, sometimes you come across something which is quite different and novel, and this is why I've actually really enjoyed recording this, because we as implant dentists, we kind of like have our scope. We're going in a certain direction, and we're constantly trying to expand the field. And it took a specialist professional in a parallel field to actually look across and go, actually, guys, you're missing something here. And this is what I like about collaboration with, it's not just about implant dentists, is speaking to other colleagues. We speak to periodontists a lot, but apparently we should be speaking to pediatric dentists as well. We just don't know what they're going to teach us. So this has been absolutely fantastic. Okay. Dr. Elisa, thank you so much for joining me today. Thank you so much. And I can't wait to give you feedback on the products for the patients that I use this for as well. Okay.
Thank you. Thank you so much, Dr. Paf. It was a pleasure and an honor to be here with you, to speak with you, to discuss dentistry, innovation, application, and, giving both value to our industry. And I congratulate you for what you are doing and for moving implant dentistry forward through knowledge and experience, because it matters, and what you do is amazing. And thank you again for the invitation.
Thank you. So, folks, just before we finish, as always, if you are interested in learning more about implants, whether you're starting or you want to delve much deeper, the Academy of Implant Excellence, all of the theories delivered online. So whether you're living in the UK, on the continent, in Canada, America, or anywhere, if you've got internet access, you can join the Academy of Implant Excellence. So as always, thank you so much for your time, and I will speak to you soon.